Well, I usually begin my day, I usually am in the office somewhere between 8 to 8:30. And the first thing I do is I run straight to my office. I like to turn on my computer, and anybody at the computer knows that takes time, all the passwords and getting in. And then I look to see who's on my schedule.
Each morning I get the privilege of coming to work here at Javery Pain Institute, and we care for a variety of patients. Each day we never quite know what we're going to encounter, but we look forward to helping each person. I enjoy coming and working with a team that helps me to care for each patient in a very personal way. I look forward to walking in the room with a handshake and a smile each time I see a patient. Even if I encounter a patient that is having kind of a rough day, or it's a new patient who has really struggled for a long time and it's the first time I'm meeting them, I try and greet them with warmth and compassion, just as if I were walking into the room with one of my family members.
I'm Dr. Chu. I'm one of the physicians at Javery Pain Institute. Today is actually one of my procedure days, so I do procedures all day in a full room just like this, and we actually bounce back and forth between two procedure rooms. I just came out of a procedure where I performed a epidural steroid injection for a patient with chronic low back pain and some pain going down their legs. It's a very common procedure. The next one I'm going to do is actually a type of procedure where we treat osteoarthritic pain of the spine with some procedure called the radiofrequency ablation, which is actually very highly effective for chronic mechanical low back pain, which is it's actually a very common thing that we see all the time in our clinic.
Some days I have only what we call evaluation days. Sometimes there are people that are back following up after a procedure or a new medicine I did for them. Maybe it's been just a couple of weeks since I did a treatment on them. Maybe it's been several months. So I see how many of those that I have to see and who do I see first. Then I review the chart. What's been the biggest goal that they've want to see happen, and what's been the biggest challenge?
I enjoy coming up with multidisciplinary treatment plans that involve a lot of different ways we can help the patient. I have a lot to offer with injections and medications, referring them to a physical therapist, working with our great pain psychologist colleagues here, and I enjoy being a part of that team, but really being the person who gets to kind of coordinate that for the patient. I enjoy being that leader for the patient to bring you into a warm, welcoming environment from the moment you hit the door in our lobby to the moment I walk through my own door in the exam room to see you. It's going to be a warm, welcoming experience for you and any significant others or family members who come with you. And I enjoy really providing that care on all levels to help each patient who comes through the door here.
We typically do all of our spinal procedures under X-ray or fluoroscopic guidance, and we use these screens here to see exactly the anatomy of the patient's spine, exactly where our needles are going to be going. So we have very, very good and accurate location of our therapies.
I like to just pull my chair up away from the computer, and I'll sit just face to face, within a couple of feet of the patient, and I'll ask, how you been doing? And how are things? Are they better since we last met? Are they worse? Have you had any side effects? Have you had any interactions with the medicines? I want to get caught up with what has happened to you since we last met, or since we last did this or changed that.
Here at Javery Pain Institute, I am confident that I am part of an excellent team, an excellent place that's going to provide warm, welcoming, compassionate care each time we see a patient. As we guide them through the visit, we explain very clearly what we can provide, from interventional procedures to medications, as well as working with other team members such as physical therapists or pain psychologists to really provide you, the patient, with the best, most comprehensive, unique plan that you need to get your life back.
Typically on a procedure day for myself, I come into the office. I typically wear this really heavy lead to protect myself from the X-ray that I'm going to be exposed to all day. We have a very efficient procedure day sort of workflow where patients come in, they get consented by our staff, and then I'm basically called on my radio here when the patients are ready, and I go into the procedure room just like this one, perform the procedure for the patient after conducting a thorough timeout and making sure that we have the right patient, the right procedure, etc. And then when that's done, the patients typically go into the recovery room where they stay for about 20 to 30 minutes, and they're on their way home. As that's happening, I'm moving on to the next patient in the other floor room or the other procedure room to continue the workflow of my procedure day. And that typically runs throughout the day until we're finished with our last patient in the afternoon.
And I'll introduce myself to the patient, and I first want to sit down and I want to talk about anything else other than the patient's pain for the first few minutes. I want to know, am I dealing with someone that's maybe a grandma, maybe someone's a single mom with the challenges that go along with that, or perhaps it's a working man who is having a lot of back pain and is really scared because he's 50-something years old and he's got a back pain, and if he loses his job, he's not going to be able to put bread on the table. So I want to find out who I have in front of me and how the pain has affected them, and learn more about their personality and their fears and their strengths and their weaknesses. Then we'll start talking about the pain, the history of the pain, when it came on, what makes it worse, what makes it better, what tests they've had done. And then I'll go over all of that exhaustively, because invariably, especially for more complex pain problems, I like to tell all of my younger physicians, the patient will tell you the diagnosis as long as you're listening.
I feel so fulfilled and excited each time I hear a story about a patient who tells me, man, I was able to go out and attend my son's graduation, or I was able to travel out west and climb a mountain because of the treatment plan you put together for me here at Javery Pain Institute. And I think that gets each of us excited here to see those patients walk through the door, experience a warm smile, a welcoming lobby, and then being brought back to a room where we can then provide a plan for you to get your life back, to function with less pain, more comfort, and make those memories with your loved ones. And then moreover, I get to come to work each day and hear about that and hear how you are functioning, enjoying life in a way that is so much better than prior to coming to our clinic. When I go home each day, it puts a smile on my face to know that we as a team here, and I as the physician coordinating the care for each patient, are providing those great results to help improve your function and to really see you get great results so your life is so much improved and your interactions with loved ones are so much better.